Awesome. Thanks so much, Ricky, for doing this. This is a great way for my team to get to know you and also for you to get to know me. So can you tell me a little bit about like what is One Up Health? I honestly don't know. I see you guys around a lot, but I'm not too sure what you guys do. What is One Up Health?
Yeah, so we're helping healthcare apps connect to electronic health records, and we're doing it through two ways. So one is basically for patients to authorize access to their own medical history to whatever app, and then the other way is direct connections to health systems. So if you guys are building an app that is for a specific hospital or organization, we can go in and get the full medical history for the entire population.
Nice.
And then it is immediately available on our API platform.
Nice.
So then you can build whatever type of application, whether it's like a consumer app, an analytics app, a machine learning app.
Nice.
All that stuff in healthcare.
So do you directly work with the hospitals, or how are you getting the integration working?
Yeah, so a bunch of the health systems are reaching out to us to authorize access to their EHRs. And then we basically get that connectivity and we make it available to other apps.
Like developers and whatnot.
Exactly.
Nice, that's awesome. Now, I mean, the healthcare space is pretty bureaucratic, right? I mean, how did you guys get in? Like, what was I think you're in a fortunate position right now to say that they're reaching out to you, but like in the beginning, like how did you even get into your first healthcare system?
So like the EHR vendors are, they're very close partners with us. So like we were early in this whole space, which was really enabled by legislation. And I think I'd love to learn more about what you guys do, but my basic thought process on startups, really any businesses, like there has to be something that has changed in the world or something new that's enabled your organization to exist that wasn't possible before. So basically, with the stuff that we're doing in healthcare, there have been new regulations that have been created that's opened up data access. It's basically creating like this new land for you to build, this whole ecosystem on top of. Think of it as like a, tectonic shifts, like moving. It unleashes a volcano, and there's like new islands created in the middle of the ocean.
Nice.
And now there's nothing there but like hard rock.
Correct.
You need some like topsoil and other things for. You need some platform for other things to build on top of, and we're trying to be that platform.
Nice. Now it's interesting because you can look at startup multiple ways, right? Some people say you find a problem, which was our case, right? You find a problem that is bothering you so much, and then you fix it. Oh, I guess this is the first time I'm hearing this, is where an opportunity comes with legislation and then you just jump into it, right? I mean, or did you have any background prior to starting One Up Health?
Yeah.
Okay.
Yeah, so like the whole reason I found out about this stuff is because of my previous job.
Okay.
Which was a healthcare startup.
Nice.
And I learned about these rules there.
Nice.
And also felt the pain of building a healthcare app. So you definitely have to understand the pain point.
Absolutely.
Yeah, like you guys are well aware of.
Yeah, nice. So yeah, let me tell you a little bit about myself. It should be about you, but about TripBuddy. So we make it easy for people to carpool to work, right? Commuting is just horrible and it's just a nightmare. And what we do is that we have a matching algorithm that automatically pairs you up with somebody who you work with. So for instance, let's say I work in the seaport, so do you, right? On a day-to-day basis, I'll drive, you drive. I mean, I know you don't drive, you bike it, but let's say if you used to drive.
Sometimes you do.
Exactly, right? But what we do is that we work with organizations and provide them with our platform to make it easy for their employees to carpool to work. So we directly work with employers and then have them push it down to third of the employees, so that we can get scaled that way.
That's awesome. Yeah, it's a good idea.
Nice. So, I mean, how long have you guys been around?
So we've been incorporated for just over 2 years now.
Nice.
Yeah. What about you guys? Around the same?
So Trip Buddy's weird. Trip Buddy's weird in the sense that it was an idea like a really long time ago. Around 2014 was when the idea was born. Like, just hated traffic and a bunch of other things. But
Did you guys ever hear about this thing called slugging?
yeah, in DC, like the slug lines.
Yeah.
Did you live in DC?
For a little bit, yeah.
Nice. Is that where you?
I slugged once.
Oh, you slugged. How was it?
It's great.
Nice.
Wait, what is
Yeah.
that?
So in DC, apparently people just stand at like random, like not random places, but dedicated places. And you know, if you have a car and you want to use a carpool lane, you just go to this dedicated place and pick up somebody, and then you slug with them.
Yeah, the Bay Area is the same thing. I was actually in a call with Zipcar, and the guy was telling me that they have this thing called casual carpooling, where people will just they're kind of like informal like stops where if you are driving to work, you can pick people up, and so that you can use the HOV lanes.
Nice. What did you think about the slug lines in DC?
Yeah, like, it was definitely great. I mean, if I had been commuting as far as I did for a longer period of time, I would have definitely done it more.
Nice. Cool. So how big is your team now? I know you guys are trying, like you're growing like crazy. Every day I'm seeing a new employee join your team.
So we're 10 people now.
10 people now. Are you guys still like hiring, or what's the deal right now?
Yeah, we're like we're still looking for a couple good people, but I think we'll be good at that point.
Nice. Yeah.
Wait, where are you guys sitting?
Right across.
Across the aisle.
You like the nice monitors, right?
Yeah, those are the ones with the nice
guys.
monitors. Yeah. Cool.
They're not that expensive. They're like $300.
Yeah, only $300.
Definitely.
Yeah. Did you guys raise? Have you guys raised money?
Mm.
Nice. Cool.
That definitely helped. Are you guys trying to?
So I think right now our focus is on customer acquisition and then raise, because I mean, as you already know, raising money is hard. If you have solid data and solid customer numbers, it makes it a little bit easier. So I think that's been our focus for the past few months. So I guess so what's your background? Like I think you worked at Google and before your health tech startup. Like what was it? Can you tell me a little bit more about your background?
Yeah, so like I went to University of Virginia, studied econ and systems engineering.
Nice.
And then I worked at Google on the Google Apps for Business team to help automate and scale support. And then I worked at a tech startup called ProMedia, where we automated search engine optimization, search engine marketing. And then I got into the health tech startup, called Care Journey.
Nice. What do you? I mean, a bunch of these guys, at least the software ones. I used to work at Oracle, and some of them want to go work at big companies, which I have no problem with. What was your take working at a big organization like Google? Did you like it?
Yeah, I mean, it's hard to complain about working there.
Yeah.
And at any of these big companies, but you definitely learn like 10 times as much at a small tech startup. So
Yeah.
basically, at my previous company and the one before that, I learned, I worked with so many different tech stacks, so many different technologies, so many different companies, and from like product to sales to like marketing, all that stuff.
Nice. Yeah, and I think one of my biggest frustration at a big company was nothing ever gets done. It's just so slow and just takes forever to just do something as simple as changing the color on the website. But hey, I guess it's not for everybody. I'm sure some people enjoy it and whatnot.
Yeah, I think like there needs to definitely be a better, place to test out things at those big companies.
Right. Yeah.
Without having to get a meeting of 30 people to all say yes.
Yeah, exactly. Yeah. So you didn't have a CSD background, right? It was much more systems engineering.
Well, yeah, I did. I mean, systems engineering is a lot of statistics and math and programming.
I see.
And during college, I built some iPhone apps.
Okay.
It was like 2009 when I graduated, so like that's when 2007 or 8 is when the iPhone came out. that's where I learned or really got into it.
Nice. Cool. Do you guys have questions? It's been only me asking.
You said that you were incorporated 2 years ago. What was like the process before that, or like what does it mean to be like incorporated versus like not incorporated?
Not incorporated. It was me. So basically, in June. I mean, not June. February of 2017 was kind of like when I started working on One Up Health stuff. I was also working on other stuff, like, just trying to feel out what I was gonna do. Then we won some government awards that helped kind of fund us early on, and that's why we decided to incorporate, because we actually had someone paying us. And even at that time, I was kind of partially One Up, partially other stuff, and it was really, it was really like later in the summer where I was like, yeah, this is all I'm doing.
Got it. Yeah, I think for me too, it was the same. Where it was Trip Buddy was been just this idea, and we got into Mass Challenge. I think that was it. When we got into Mass Challenge, which was around summer of last year, I believe it was August, is when I actually left my job to say, this is really what I want to do. I want to give it my all, see if it's going to work. If it's not going to work, you never know.
I definitely think you have to do that.
Yeah.
So do you guys have clients?
So we do have a few pilots that we were running, some mosques and stuff like that. And it's been a challenge. Like with the pilots especially, don't have a lot of skin in the game. So it makes it a little bit hard.
Is there any like incentive for users other than like, because in Boston traffic's like shit.
It is.
It's the worst.
It is the worst in the country.
I think it literally is the worst.
It is. It is the worst in the country.
And like they don't really do, from what I've seen, like the highways are kind of weird. Like they're not. Are there even carpool lanes here?
There are. I think it was. What highway is the bridge on? What's the name? The big bridge right next to TD Garden. Yeah, 93. Yes, there's HOV on 93. Actually, on both sides, on 93 South and 93 North. I think there is. And I think so I commute from Quincy, and what I've seen them do is, like in the morning or in the evening during rush hour, they expand one of the lanes, right? So it's like regularly it's 3 lanes, but based on the direction of the traffic during the time of the day, they make the one lane 4 versus 3. I've seen that. Still it's not helping.
Yeah. And I'm like curious, like, what do you guys think about, like, clearly working, using carpool is going to reduce traffic for everyone else,
of course,
which is awesome. But I think like a lot of people care more about the convenience of like something like a Lyft or an Uber, or driving themselves.
Yeah, I mean, I think you hit it right there. It's a whole mindset shift, right? That's kind of why we struggle with our pilot a little bit. It's a whole mindset shift, right? You gotta educate people. You gotta make the thing as dead easy as possible and as super convenient as possible. Matching does not have to suck. And those are some of the things that we're optimizing for, the entire experience. How can we make you feel like, oh, it's still my private car and I can still leave whenever, and but it's actually a carpool, right? So that's sort of the things that we're solving for, and the things that we're
Have you thought about like, the lessons that, or like the success of slugging? Because like I don't know if there's been any app that's like institutionalized slugging, but like maybe it could make sense to like try something where and maybe it could just be free, like, and you could get paid from employers, or try it, I don't know, some membership, I don't know, whatever it is, but like have these like designated spots for people to pick up and drop off. I don't know if you've thought
No, we haven't actually. We haven't thought about that, because again, one of the challenges when you work with an employer only, or when you work with a community center only, you're only limited to that group. So your number,
tiny,
exactly, your number is tiny, right? When you work with like big organizations, I think it makes it a little bit easier.
Yeah.
Which we had a call with an employer for, how big was World Bank?
Real big, 9,000.
Yeah. So like if you're able to have, if you're able to close an account like that, definitely makes sense. Like 9,000, that's more than perfect number for us in terms of matching and whatnot. So
yeah, I'm just thinking like maybe there's a consumer play to it too, right? Because like, or maybe I understand why the employee thing makes sense. Like that makes perfect sense.
Yeah.
But if you're at a smaller organization, if you could tap into the rest of the consumers or the rest of people that are still going the same direction, you would be able to significantly expand your scope, because you guys like have like a critical mass problem. Right?
Exactly.
You have to have this critical mass before it makes sense for people to use it. Like on our team, it wouldn't make sense.
Absolutely,
really.
you guys are too
Like
small.
either we're too small and people are just going to talk to each other about it, or we're too small because there's not enough people coming from all these the same places.
Exactly.
But as you get big, totally makes sense.
I think that's what, some of the things that we want to do is, let's say, so we're trying to work with Mass Challenge, right, for the summer, where it's a community where you have a lot of startups or a lot of companies, which it's just small pockets of people, but it's a great opportunity for people to, cross-pollinate and network.
Yeah.
But the challenge for that is, because it's a complete mindset shift. We send them a statement of work. Actually, I think I asked you about a statement of work. Remember that, right?
Did Anthony give you yours?
You said what?
Did Anthony give you yours?
I did. No, he did not. But I think I talked to you. I was like, hey, what do you guys send to your?
That was for Mass Challenge.
Actually, that was not for Mass Challenge. That was for another partner. Okay. It was for a pharma company in Cambridge that we created it for. But I think I was reading online about what statement of work is, and it actually shows like an outline. Okay, this is what I'm gonna do. This is when I'm gonna do it, and that this is what I expect in terms from you. Yeah. So we send that to them, and I think that's what we're gonna be doing moving forward, because we need skin in the game, right? You're just saying that we want to introduce carpool, and it's not good enough for us, right? You got to be committed that you're gonna set up some dedicated parking spaces to encourage the behavior. You gotta be committed to having my team come down and come talk to your team about it, and have this periodic check-in points. So we sent it to them. If they do sign it, I think it'll be great. I'll be happy to work with them. But if they don't sign it, I'm not going to be happy to work with them, right? Because again, it's just a waste of my time, and it's a waste of the time of the rest of the team.
Yeah. What are you guys like charging, like $1 per person or something like that?
So it depends on the mile. It's like I believe we're under like 56 cents per mile. It's based on IRS regulation to be considered like a work commute. But we charge employers a set fee. So we charge them a few amount of dollars to be able to, give them the complete suite of the program, the reporting, the dashboard, the marketing. But like a pilot like Mass Challenge will be a completely $0, right? But what we need from them is the commitment to actually make sure that they want to champion it and they want to see it succeed.
Yeah.
Yeah.
And is there a way that is there any rule or regulation around reimbursing companies if maybe like as a tax write-off or something, where if you save on commuting you get some benefit? I don't know if there is.
Yeah, there are some few regulations going around. We actually just joined this association where they sort of lobby for things like this. They're definitely pushing hard for a few regulations to make it easy and to reduce the burden. That we're kind of paying attention and close eye to, maybe a few of those passing. I think we might be in a better place.
Gotcha. But you charge 50 cents per mile.
52. No, I'm sorry. It's like 56 per mile. Yeah. It's about 56 cents per mile, and it depends on the employer as well, right? So there are some employers who don't want the employees to pay any money at all.
Yeah.
And what we do is when we charge them the base fee, we subsidize as 100% for the employee. So let's say if you guys paid us, to use TripBuddy at 1UP, the way it's gonna work is if Anthony rides with you to work, instead of you paying Anthony, we pay Anthony. Right?
Oh, so the person actually gets paid?
Exactly. So there's that incentive, right? The person actually gets paid, but they're not like the person sitting in the car is not the one getting paid. It's not the one who's paying.
Got it.
Yeah.
Got it. Yeah. Interesting.
Yeah. Definitely, there's a few models that we're trying, but I guess the big push for us right now is the customer acquisition and doing more successful pilots, right? Because again, doing unsuccessful pilot is just draining too.
Yeah,
at least for us.
I think like, thinking about it, what could also make sense is like, the demographic of the customer
Mhm.
or of the employer that you're targeting. Like, someone who's getting paid like above $100,000, they're probably not going to care about this
That's true.
as much as like Walmart, which would be thousands of people,
You're right.
tens of thousands of people at specific locations.
That's true.
And they would care about getting paid.
Yeah. But then you have to think about this, a social feel good to it, right? I think millennials who are trying to get jobs, everybody wants to be sustainable now, right? And that's kind of a way for them to say, oh, I'm commuting to work and, being sustainable. Just like you bike in, sometimes,
I think like the number or the percent of people that care about being sustainable is like much smaller than we would all like.
Yeah. It's about their like how can this make my life easier?
Exactly,
Yeah.
totally.
Right.
Like
Yeah.
like you care about sustainability, right? That's why you're biking. Like unless maybe that's the most convenient way for you to get here.
It is the most convenient way.
Okay. So that's not everybody.
But I would also bike even if it weren't. But it is.
Yeah. There you
Yeah.
go.
Like it's basically a toss up between biking and driving.
Yeah.
But I think like like either you have people that care about the money that are like lower income,
Mhm.
or you have people that are higher income that don't care about that and they care about convenience.
Right.
So if you can, I would think like if you can solve those two different ends of the spectrum, then that would be a good path.
Yeah, going forward. Yeah, no, I definitely do think there are multiple ways to look at it, but
Yeah, I mean, we're still figuring this out on our own too. Like
Yeah.
we're looking at different pricing models and stuff, and
speaking of price, and it's funny, I asked Anthony, because apparently you got congrats. Well, I guess this is late congrats, but you guys are going to be working with Athena, or is it Ethna?
Athena.
Athena Health.
Athena Health.
Yeah.
Yeah, like not like they're not paying us, but we're gonna be integrating.
Oh,
Yeah.
so who is apparently you guys might be having a big contract coming up, no?
Oh yeah.
Yeah. So I was like, how are you guys like figuring out price? And like, it's like you guys just make it up. I mean, I think.
Yeah, we're just trying to do something simple like $1 per patient per year.
Yeah.
Like, it's very easy to understand.
Yeah.
Yeah, and one of the biggest points of feedback that we've gotten is that people that we're trying like AWS style
Mhm.
pricing,
Mm.
and people just find that confusing because they don't know how much
What you're using.
you're
and-
gonna pay for a year. Yeah.
Yeah, no, I think we're struggling with pricing as well. I mean, I just make up numbers based on the size of the group. It is a crapshoot. Like I make, if I feel, feel like you can pay a lot, I usually ask for a lot of money, right?
Yeah.
I mean, if I feel like you cannot pay a lot, I usually tone it down a little bit. But I think for them, they want to justify. Like, what does 30K mean? Or like, what does 100K mean? Does it mean that like 10 employees were using it? Does it mean all my employees? So it definitely is a challenge for us.
Yeah,
as well.
I think if you were not to price it like high up front,
Mhm.
and price it by usage,
Yeah.
you'll be better incentivized because like the whole point is for you guys to get people to use it,
Right.
and they will find it to be a lower barrier to entry. So like $0 to start, we just charge you based on the number of miles that we connect people with.
Yeah. Well, that's something.
It's definitely like more risk on your side.
Of
because
course.
You may not get paid anything
Exactly.
if people don't use it, but like,
Yeah.
if people aren't going to use it anyways, then
There's no value.
You'd rather know that earlier on rather
Than
than
later.
like have a $10,000 contract and like have no one use it and then just be pissed off.
Yeah.
Like, what do we pay for?
Exactly.
So I think making sure you guys align incentives properly. That's same deal with us. Like that's why I wanted a price per usage.
Mhm.
Because if people aren't using it, then
There's no value. Yeah. Interesting.
yeah.
Any questions from the audience? No? So what's next for you guys? I mean, I think you guys are like big boys. You get in a new office, right? Is it?
Well, we're only because we're getting kicked out. We didn't want to. Yeah.
So are you still getting a new office?
Yeah.
Okay.
But we have to pay for it.
Yeah. We got a deal. What if I offer you my space, and I say you guys are part of Trip Buddy.
I would be totally down.
All right, we can work something out. You know, we can totally work something.
I think the mass challenge people might catch on.
Yeah. No. So but what's next though? What's coming up in the pipeline? Like what's what keeps you awake? And
I mean, I just want to make sure that we really crush some of these bigger contracts that we have, both in terms of like product and whatever services we're offering them.
Nice.
That's really the main game. Like that's all I really want to happen.
Nice. And then you just brought on new people to be doing sales for you as well too, right?
Yeah, we're trying to ramp up on that side a little bit too, like on the existing product that is like repeatable. Just get people to think about how to market and sell that.
Nice.
Yeah.
Cool. Do you have a question?
So just to be clear, so your product is like connecting different healthcare providers with like, so that they can share patient information?
Connecting any app or product or health system that needs to see electronic health data.
And so how does that work with like privacy?
So the individual patient either authorizes directly or the health system authorizes their entire population to specific organizations that they have legal agreements with.
And then is it common for patients to directly authorize, or because I feel like you wouldn't have like...
Yeah, we're still trying to figure that out. Like we have thousands of patients that are authorizing access to our own apps, and we have patients authorizing access to other apps, but we're not sure like how it's going to scale. Like we know technically it's definitely going to scale, but like what is that magnitude of patients that are understand how to do this or willing to do it, all that kind of stuff.
And
we're still very early.
Are there any like products that are being developed right now, like any apps that people are creating or that you're creating internally?
There's like 300 healthcare apps that have signed up with OneUp Health, and about 100 of them have some level of production access.
Nice.
So now we're just like figuring out how do we get them from like production access, calling our APIs, to like really in production with thousands of patients.
And what kind of like end products do you like foresee like them creating?
Yeah, so there's all kinds of stuff. There's like patient intake forms. So rather than like filling out a piece of paper front and back, you like in 10 seconds authorize your access, and then it auto fills everything like that. Like literally could be hundreds of pages. We have like cancer treatment management applications that allow you to see your medical records from different places in a single view. Then there's like medical AI chatbots, things that keep you engaged for like patient trials. It's really all over the place. Life insurance, underwriting.
Cool. I think I have a question. So you sell to, you have two, you kind of not, you don't have a double-sided market. Well, you kind of do have a double-sided market where you have the developers, right? And then you have the health organization or EHRs or wherever you call them. How are you bringing developers onto your platform?
So it's just online, like people are finding out about us, or we're going to conferences and they're hearing about us. We haven't really done any outreach. So we're really fortunate in that regard right now, but like we definitely need to figure out how to get those organizations that are interested into like production, like real like thousands of patients interacting. And maybe some of this is like improving our documentation.
Right.
Maybe we pre-package like the most common use cases, and just like that's really easy. You just give us like your server and we just send the data there.
Nice.
There could be a bunch of other ways, but we're trying to figure out how do we make a very technical product very accessible.
Nice. Yeah, I think one common recurring theme is when we spoke with another startup from Food for All last 2 weeks ago, and I think the reality is, I keep telling these guys, is you're still figuring out a bunch of stuff as you're going on. You know,
Yeah.
you don't have. It's not like we're in a big organization where you have all the answers to everything.
Yeah.
You know, so there's so much uncertainty and a lot of let's figure stuff out.
Yeah, and I think like the best way to do that is to get people using the product,
Mm-hmm.
and the best way to get people using the product is to make it free.
Mm.
So, yeah, I would definitely suggest at least maybe for some time period. Maybe you say to these organizations, hey, for the first 3 months
Mhm.
you're free, and then if you want to continue using it, then you pay us or something. That way you get in the door, and when you see like when people actually start using your
Yeah.
stuff, they'll be less likely to stop using it unless like it's
Or
terrible.
Yeah.
But I'm pretty sure it's not.
Yeah.
So I think like that's the best way for you guys to get feedback and iterate, because until you have people using it, you're not going to know why people aren't using it.
Yeah, no. I think we definitely do have seen some, but I think trying to get over that hump and let more people use it is kind of what we're going after. I think I guess I'm just too jaded with like free, because people just don't take free serious, but I think we can bend over that like a lot. But
Well, yeah, it doesn't have to be free forever.
Yeah,
It could just be free to start.
yeah.
Like there's so many, like basically every SaaS offering has
Mhm.
some sort of free trial.
Right,
Just
right.
have a free trial,
Yeah.
like 30 days. Start with that.
No commitment if you don't like it, but I'm sure you'll like it.
Yeah.
Cool. Awesome. Well, if you guys don't have any questions, Ricky.
We have a free tier, by the way. On
Oh, you have
our
a-
APIs. That's why I mentioned.
Are you trying to pitch it to me?
Yeah, I'm just.
I'm just kidding.
Well, it'll make it easier, right?
Yeah. Pitch. Start using connected all our driver data using TripBuddy to One Up Health.
Yeah.
But that's awesome. But
Yeah.
I appreciate your time. I know you
Yeah.
probably have a busy thing to go work on, and thanks for stopping
Yeah.
by.
Thanks, guys.
Pleasure.
Yeah, we're right next to you for the next week. So.
Oh, you only have a week left.
Yeah.
That's a bummer. We'll help you
Yeah.
move out.
Where are you guys moving to? We're moving downtown, so to like Washington Street. Yeah. It'll be more convenient.
And more money.
All
All right.
Thanks for the pizza.
All right, no worries. Thanks for coming.
Yeah, nice to meet you guys.